The Department of Justice is once again blasting the Department of Corrections for failing to provide adequate care to over 700 prisoners. In the latest court battle, although a joint proposed timeline was submitted, the two still don't see eye to eye on many issues like mental health and emergency services. Just a few weeks ago, Chief District Court Judge Francis Tidingo Gatewood ordered the Department of Justice and the Department of Corrections to submit a joint proposed timeline for the Corrections Department to come into compliance with a 23-year-old stipulated agreement. That joint timeline was indeed submitted, and while the parties seem to have agreed on a number of areas, for the most part, they disagree on the same issues that DOC has struggled with for years. Justice Department Attorney Jeff Murray says DOC claims that it is currently providing adequate health care and meeting inmates' needs, but the available facts don't support it. For example, he says only 5% of dental patients are being helped, and only 34% of mental health patients get treated. This is because DOC has not had a psychologist for 7 months. So, only inmates who are fortunate enough are driven to Guam Behavioral Health, and even with that, it still depends on the availability of DOC guards and vehicles. Despite this apparent shortcoming, says Murray, DOC continues to claim that it has been providing adequate mental health care and that it doesn't need a psychologist. The number of nurses DOC needs is yet another issue. DOC says they are fine with 4 nurses, even as their own medical director, Dr. Raja Saad, says he needs at least 5.